Well, this unit would provide a service for diabetes patients, both type 1, type 2 and gestational diabetes patients. And our aim is to keep these people within optimal control with their blood sugars, and thereby we're reducing complication risks. I think that the role that I'm undertaking at the moment is very diverse. It's probably about 30% managerial, 20% clerical, and I'd say 50% is patient involvement. I come in the morning, find out what clinics we've got running, what staff we've got to work with, and we allocate those staff accordingly. We try to make sure that all the clinics are running on time and that patients are satisfied with the service that they're getting. Linda Smith, would you like to come through? Hello. If patients actually listen to what you're asking them to do and they reduce their risks, their complications, and to know that you've been a part of that, it is really very exciting. Nursing was something I always wanted to do. When I left school, I went to work in retail, spent a lot of time in retail, and then I had a break and had my family. When I had my last son, I decided that I would go back to college, and I got some GCSEs and some AS levels and an A level, and decided that I wanted to redirect myself now, and that it was my time, and it was time for me to build a career for myself, and I wasn't going to let the chance go. I started work in nursing initially in specialist orthopaedics, which I did for 8 years. But my real interest lay in health promotion, and I'd always been interested in diabetes and attended any of the study days that we had that were linked to that. So for me, coming into this role of specialist nurse in diabetes, it was a huge learning curve. I had to learn about diabetes, all the related problems that go with that, and about complication risks. So it's been, I feel, a very exciting career. A clinical nurse specialist has a huge role. We deal with many different departments, and we are responsible for taking care of our patients. We could have a patient who would come in and we're looking at diabetes control. Next minute we're looking at erectile dysfunction, and we need to then refer that patient into another department, which is something that we actively do. We're looking after the patient holistically, so we're looking after all aspects of the care, both physical and mental. And it's very rewarding. I work in antenatal, and our end result there is a healthy baby and a healthy mum. And we do work those girls hard in antenatal. We give them really tight controls for their diabetes. And we work with them and we support them, and we get them through to a good outcome. At the moment, I'm a clinical lead for introducing new drugs into the health service. This is a joint venture between secondary care and primary care, and we've developed an audit so we can monitor these drugs and ensure that they're being used safely, and that we're looking at long-term results. We've just completed the audit in February, and only as recently as last week we've presented the results. So that was in itself is a real challenge. I'd never done audit before, and but I thoroughly enjoyed it, and I felt we got some really worthwhile research from it. I've got a little bit of a problem with this patient. Within my role, I actively liaise with consultants. We've got 3 consultants working here. With dietetics, we've got our own dietitian for diabetes, which is very useful. We liaise with the digital photographers. We do patients' eye drops and the rise of photograph to monitor their retinopathy. We interact with primary care team. There's the diabetes team for the area. We'll refer into those. I'm a member of the clinical advisory team for Dudley, and we establish policies and procedures for the area. And I'm also a member of Standard 3, the Patient Empowerment Committee, and we meet national guidelines for those. I get involved in writing policies within the unit. I think these additional roles help me to look at nursing more globally and look at the bigger picture. So I'm not just looking at what's happening in my clinic with my patients. We're looking at the whole of the area and trying to do the best for all diabetes patients as a whole. I think nurses need to have empathy. They're dealing with very vulnerable patients, and they need to be able to do that sensitively and treat patients with respect. They need really excellent communication skills. You're going to be meeting patients that are distressed, they're upset, or they're going to be looking to you for comfort. I know we need a lot of academic qualifications to be nurses, but to be good nurses, I think we need life skills. I do like a challenge, and I want to go as far as I can go, and I'm willing to put the work in. I enjoy putting the work in, and I don't see why I shouldn't have it.